Hi everybody, this is the online lecture for Chapter 9, Stochastic Effects and Late Tissue Reactions of Radiation in Organ Systems. We are going to talk about late effects, and these are the effects that can happen after the initial radiation exposure, but they manifest later in time, usually years after the radiation-induced exposure. Okay, that is in contrast to what we talked about last chapter as the early effects, which can manifest in minutes, hours, days, weeks after the exposure. And they present as nausea, fatigue, redness of the skin, hair loss. Okay, these are the late effects. They occur years after the exposure. They manifest as cataracts, leukemia, genetic mutations, etc. Okay, the science that deals with these late effects is called epidemiology, and it's just a piece of it that's dealing with the radiation-induced cancer. This science deals with incidence, distribution, and control of disease in a population. What we're concerned with epidemiology is the studies that include the risk of radiation-induced cancer, okay? And radiobiologists will use this information that these scientists get to formulate dose-response curves to predict the risk of cancer in populations that have been exposed. So known exposures to a population. Then they study them and they produce charts that can try to attempt to predict the risk of occurrence of a malignancy. So it's not an exact science, but they have grafted this data and it gives them some ideas of what you can expect based on your dose. Okay, the first kinds of curves that we're going to learn about, and they're not necessarily curves in our sense of the word, but it's still called a dose-response curve, just so you know. First one is going to be the linear, which is a straight line, non-threshold curve, and that's depicted by this blue line. There is no threshold, so any amount of dose that you receive will have a response to that radiation as a biological effect that we can observe. Number 2 shows there is a threshold. There is an amount of dose that you can receive and there is no effects expressed. Okay, that's called a threshold. So that's a linear threshold curve. And then number 3 is the sigmoid or S-shaped. It's nonlinear. It is a threshold curve because there is a point where you have a certain dose and there's no observable effects. Okay, then after you get to the certain dose, then you do see effects and then it tapers off again. That's mainly used for radiation therapy studies. Okay, the first one that we're going to be concerned with is called a linear non-threshold. It's denoted by LNT. And it proclaims that there is no radiation dose that can be considered absolutely safe. So this is an LNT curve. No radiation dose, as you can see, can be exposed or absorbed without some sort of response to the radiation. Okay? Linear non-threshold. Okay? Okay, then in 1980, the committee Biological Effects of Ionizing Radiation took all of the data that they have gotten from the atomic bomb survivors, and they concluded that most of the stochastic effects, so most of the cancer from low dose levels of low LET radiation, appeared to follow a linear quadratic non-threshold curve. So that's this curved part here on this chart. So a linear quadratic. So they said, well, you know, this data appears that this curve is what's representative of what really happened to these people, and it's a little bit more conservative in regards to what the response would be. So for instance, if you took this spot on this curve and this is the dose that we are studying, and if you go to the first linear quadratic, the response is not as high as if we're using the LNT curve. And so it's a little more conservative for your response in regards to the dose that you've received. And so with the data that they had acquired, they figured, okay, so the effects from these atomic bomb survivors are following this linear quadratic, so it's a little more conservative. Okay, then in 10 years later, so since the 1980 report, newer risk models, updated dosimetry techniques have provided a better follow-up study for these Hiroshima and Nagasaki atomic bomb survivors. And in 1990, the committee revised their risk estimates. They indicated that the risk from radiation exposure was about 3 or 4 times greater than they had previously projected. Okay, so currently the committee recommends the use of the linear non-threshold curve for most types of cancers, okay, and that is that blue straight line. So any amount of dose is going to have an observed biological effect. Okay, so in this equates to there is no amount of radiation that you can absorb without some type of biological effect, so no safe amount. Okay, so as a rule, with that no safe amount, using the linear non-threshold curve, radiographers must never fail to be aggressive on radiation safety measures, okay? All right. However, they are still acquiring data, okay? And there is this other non-threshold risk estimate curve, that quadratic curve that we had talked about before, that some people are saying, you know, some of these cancers are following this other curve. They're not following that linear non-threshold curve. They're following the quadratic curve. And so with as more data comes in, for leukemia, for instance, this LQNT curve, this hypothesis, appears to be supported by the leukemia occurrences in Nagasaki and Hiroshima. All right, so what they are recommending is the LNT curve, the straight linear line curve for most types of cancer. However, the LQNT curve is the most accurate reflection for leukemia, breast cancer, and some inherited effects. Okay, and what I need you to remember for your test is that the LQNT curve is associated with leukemia and breast cancer. All other cancers are associated with the LNT curve. Now this next curve we're going to talk about is an LTDR curve. So that is the linear threshold dose response curve. Okay, so the linear threshold dose response curve is that second curve that we looked at the very beginning. It has a bit of a threshold, follows a straight line up. This is for high dose cellular response. So this is the curve that they use when you have received a high dose. It does have a threshold, and they have taken data from laboratory experiments on animals and data from human populations that have received high doses, and that has provided the foundation for this curve. Okay, the threshold means, in reference to ionizing radiation, that a certain radiation level or dose can be absorbed and no biological effect is observed. Okay, the next curve that we're going to be looking at is the sigmoid or S-shaped nonlinear curve. It does have a threshold. Okay, this is used for radiation therapy. And it shows that at the highest radiation doses, the curve gradually levels off and then veers downward. And this is due to the affected living specimen or tissue dying before the observable effect appears. So note, all you need to know on this is that it is another threshold curve, okay, and it's used for radiation therapy. And this is a little bit more information that you can read up on that curve. The tail of the curve indicates that a limited recovery can occur at the lower radiation doses, though, okay, but those higher doses is where it starts to veer off downward. Okay, somatic effects. When living organisms have been exposed to radiation and they sustain biological damage, they are termed as somatic effects. Remember, soma means body. So the classification of somatic effects can be subdivided into two: stochastic effects and tissue reactions. An example of a stochastic effect is cancer, and an example of a tissue reaction is cataract. Okay, so look at this sentence by tissue reactions. It says both the probability and the severity of the effect depend upon the dose. So depending on what the dose is how much more severe your cataract would be. Now look at the stochastic effect one. It says the probability that the effect happens depends upon the received dose, but the severity of the effect does not. So it doesn't matter. If you have a dose, the probability is that the effect will happen, for this instance, cancer. But the severity of that cancer, it doesn't matter how much dose you got. So cancer is cancer, and the severity of that type of cancer isn't going to matter if you just got a little bit of a little dose or a big dose. It's not going to matter, okay? Okay, here's a chart with late tissue reactions. Examples are cataracts, fibrosis, atrophy of the organs, loss of parenchymal cells, reduced fertility, and sterility. Okay, stochastic effects, cancer, and hereditary effects. The ones in the middle here are effects from an embryo fetus in utero. Okay, so these are effects that come to fruition, late effects, after a dose of radiation while the victim is pregnant, okay? And these are all the manifestations that can occur for that fetus or embryo. Okay, so late somatic effects, they're consequences of radiation exposure. They can occur months or years after the exposure. It can result from just a partial body exposure or a whole body exposure. It can come from a previous high radiation dose, or it can come from a whole bunch of low-level doses sustained over several years. Okay, since we're talking about contracting cancer, the risk estimates for getting cancer from ionizing radiation, it is a consideration for patients and personnel like us that are exposed to ionizing radiation as a result of procedures or working in the field. However, the risk for us actually developing a malignancy from this is still controversial. There is no conclusive proof that shows that an exposure below 0.1 gray can cause a significant increase in our risk of getting cancer. So, and they are attributing that to maybe the risk is non-existent. Now, going back to late effects. So major types of late effects. Cancer, carcinogenesis, which is a stochastic event. Cataracts, which is late tissue reaction. And birth defects, another stochastic event. So stochastic is, the definition is a mutational or randomly occurring biological change. It requires years to be noticeable in a population, and the examples of these are cancer and genetics. Okay, so risk estimates for cancer. Exposure to ionizing radiation may cause cancer. At high doses, the risk is measurable, okay? At low doses, which include occupationally exposed individuals like yourself, the risk is not directly measurable in population. And like I said, that could be because the risk is negligible. We do not think it is zero in our field, especially since we are using the LNT curve, where there is no safe amount without some type of observable effect, even if it's late. But it could be overshadowed by other causes of cancer. Okay, so the current radiation protection philosophy, we use that LNT relationship, which assumes a risk still does exist, okay, even though it's hard to directly observe these and attribute them to ionizing radiation. So say a radiation field worker does get cancer, 30 years after they started in the field. Is that due to exposure to ionizing radiation? Very, very difficult to blame that on ionizing radiation. It's a very controversial concept. Okay, so there's two ways to predict a cancer incidence. They have given the terms absolute risk and relative risk. Both of these models do predict excess cancer risk if you've had any kind of ionizing radiation. And we'll show you those. Okay, so both of these have the blue area, which is spontaneous incident. And what that means is even if you've never had any type of ionizing radiation, the risk of you developing cancer is this blue area, period. No matter what, everybody's got the same risk, okay? And the risk increases as you age. Okay, so now add the red area. The red area is the extra risk that you now have because you were exposed to ionizing radiation. Okay, the absolute risk model shows that this excess risk does exist because you had ionizing radiation, but it follows the same curve as spontaneous incidence of cancer. So there is an estimated increase in your risk, but it still follows the same curve. That being older increases your incidence. Okay, versus the relative risk model that shows, yes, you have this increased risk from having this dose back here of ionizing radiation, but look at what happens as you get older. Your risk increases even more. Okay, so this relative risk model, this predicts that those excess cancers get even more, increase even more as the natural incidence of cancer increases, versus the absolute risk, which just says there is a finite extra risk that you get from getting ionizing radiation. Okay, so the models that are used by researchers for extrapolating our risk from high dose and low dose data are the linear and the linear quadratic. Okay, it says here the 1989 report supported the quadratic model for leukemia only. We are going with leukemia and breast cancer as using the LQNT formula or DR curve, and that is on page 162 of your book, so that's what we're going to hold to. All other cancers would be LNT. Okay? And this is the LNT, and this is the LQNT. So breast cancer and leukemia, all others. Okay, cancer is the most important late stochastic effect caused by exposure. It's a random occurrence that does not seem to have a threshold, and for which severity of the disease is not dose related. Okay, so it doesn't matter how much dose you get, doesn't make your cancer more severe. It's cancer is cancer. Okay, radiation-induced cancer. So laboratory experiments with animals and statistical studies of human populations exposed prove that radiation induces cancer. Now, it may take 5 or more years to develop in human beings. Unfortunately, the physical appearance of cancer induced by ionizing radiation versus cancer that's natural causes, you can't tell the difference because the physical appearance is not different. Okay, so it's very difficult to identify. Human evidence of radiation-induced cancer comes from these studies that have been going on from survivors exposed to high doses of ionizing radiation. So atomic bomb survivors, Marshall Islands, etc. Okay, here are some of the known populations that were exposed to radiation that we have used the data to extrapolate that, yes, this radiation then caused their cancer. Okay? The first group is the radium watch dial painters. And this is from the 20s and 30s. And these were mainly young women who used to paint watches and clocks with radium-containing paint. And sometimes they would brush the tip with their tongue or their lips, okay, while they were using this. Well, come to find out, they are estimating the dose was about 5 grays or more to these poor women. They developed osteoporosis, which is decalcification of the bone, because apparently radium is a chemical similar to calcium, so it was incorporated into the bone tissue, which caused also bone cancer. And then other malignancies they saw in this population was cancer of the epithelial cells lining the nasopharynx and the paranasal sinuses. Okay, the next group, uranium miners. Keep in mind that these were the early years of the last century. They worked over in Europe, mining a uranium ore called pitchblende. It's a radioactive element, very long half-life, so it's going to be around forever. One of its decays is radon, so they have been inhaling radon. So it comes to find out 50% of the miners eventually succumb to lung cancer, 50%. Then during the 50s and 60s, Navajo people of Arizona and New Mexico mined uranium to meet the need of the U.S. government, and they ended up estimating that their equivalent dose was 10 sieverts or more. And the families of these miners were also affected because of the clothing worn by the miners was contaminated. Okay, the next group is the early medical radiation workers, radiologists, dentists, technologists. And we do know from before that they succumbed to leukemia and had some terrible burns and cancer induced from radiation. Okay, back to 4 patients injected with the contrast agent Thorotrast. This was used in diagnostic angiography and ended up being deposited into the patient's reticuloendothelial system, and that's your immune system. So as a result, succumb to liver cancer, spleen cancer, biliary duct cancers. Okay, number 5, infants treated with x-rays to reduce an enlarged thymus gland. This was during the 40s and 50s. 1.2 to 60 grays of x-rays used as a therapeutic dose. As a result, some 20 years later, thyroid nodules and cancer in these young adults from the exposure as an infant. Okay. Number 6, children of the Marshall Islands, and this was due to a nuclear test where the wind shifted and fallout fell on 2 atolls next to the island, Marshall Islands, where they were being done. The children of those atolls were exposed to radioiodine. One of them, they are measuring at 21 grays. So, and the next island was 2.8 grays. So as an average, the population received a dose of 12 grays during that test. And as a result, thyroid cancer. Okay, the next group is the Japanese atomic bomb survivors. And we know that they had solid tumors in the 50s and 60s occurring, and the bombs were dropped in 1945, so late-term effects, 50s and early 60s, of solid tumors, thyroid cancer, breast cancer, lung cancer, bone cancers. Leukemia as well, but that was within 2 years. Okay, the next group, the patients with mastitis. They tried using ionizing radiation to relieve the mastitis. As a result, they received a mean dose of about 247 centigrays, which is 2.47 grays. and the breast cancer incidence doubled with this group of women. There were 531 women that got this therapy. Okay, and then the last group is the evacuees from Chernobyl. And what we're finding out with them is there's a lot of studies that still need to be done. The accident occurred in 1986. They evacuated about 50,000 people within 36 hours out of the area. Okay, an additional 85,000 people were evacuated within 14 days after that. So in the effects that they are finding now, the subsequent findings for these are a 50% increase in leukemia, a lot of radiation-induced cancers, and we'll talk a little bit more about this in the next couple slides. This is a burn from X-ray burn in 1904, so this is a cancer that was caused from X-ray. Okay, so the incidence of leukemia has slowly declined since the late 40s and early 50s, but the rates of other radiation-induced cancers have continued to escalate since the 50s and early 60s. And that's that variety of solid tumors like thyroid, lung, breast, bone cancer. Now this is a graph that just shows how the leukemia incidence has gone down. And they believe that's just due to leukemia manifests and shows quickly within 2 years of the exposure rate. And then after that, you have treatment. So the incidence is going down, okay, versus other cancers that take this time, those up to 10 years to develop and then present themselves. Okay, this is an interesting study. So the natural incidence of breast cancer in women, and then they took the women that were exposed over in Japan, and they compared the two, and they found that there is strong evidence that ionizing radiation causes breast cancer. So with the incidence of breast cancer rising in this women, they figured that it increased the relative risk for breast cancer to about 10 to 1. Okay, this is just a little slide about the effectiveness of ionizing radiation as a cancer-causing agent. We know that it causes cancer, but we don't know that it's highly effective at causing cancer, and they're using this study to substantiate that statement. Out of 82,000 bomb survivors from 1950 to 1987, they were estimating that there would be 4,500 cancer deaths. And that would be the expected cancer deaths from that normal population. Okay, what they found were there were 4,750 deaths that actually occurred from cancer, which was only 250 more than the normally expected amount. So that led them to make a statement that about every 300 atomic bomb survivors, one would die of malignancy that was attributed specifically to radiation dose of approximately 0.14 sieverts that they received. Okay, this next slide shows radiation dose and the link to leukemia. So evidence again from the atomic bomb survivors indicate the chance of contracting leukemia as a result of radiation exposure is directly proportional to the magnitude of the exposure. Okay, so radiation-induced leukemia is assumed to follow that LNT dose-response line, okay, compared with leukemia in populations that's not been exposed to ionizing radiation. Okay, more recent reevaluation of the type of radiation that was released, so this is just more data coming from that study. They are now figuring that the type of radiation that has made everyone incur these late effects was not the type that they had thought. They thought neutrons were to blame for most of the damage, okay? But recent studies have revealed that the uranium-fueled bomb dropped on Hiroshima provided more gamma radiation and less neutron exposure than previously believed. So they updated the data. Okay, so the inhabitants of Nagasaki who were exposed to just plutonium bomb received 10% of the exposure from neutrons and 90% from gamma. So with that revised data, they realized radiation-induced leukemia and solid tumors most likely were attributed predominantly to gamma radiation. So that impact just led them to make a statement that the significant increase in cancer risk estimates for both gamma and X radiation. Okay, this is just a slide that of facts that they know from the Chernobyl nuclear disaster. They need follow-up studies. They did evacuate people. They don't know how that affected any of the risk yet. The worldwide effects of the accident from fallout, they're estimating 20,000 cancer cases will be blamed on the Chernobyl incident of radiation-induced malignancies. The physicians did attempt to try to prevent thyroid cancer in the area. In the children, they gave them potassium iodide to try to bond with the receptors in the thyroid so that the radioactive iodine would not bond and would not stay in their system and produce cancer 10 to 20 years after. So they had to distribute that and had to wait to see if that was going to work or not. So after 1996, 2006, they were able to get data. They did in 1996 find that there were 700 cases of thyroid cancer were diagnosed in children residing in the surrounding areas. So that is the most pronounced health effect of the accident. Breast cancer has increased. They're not sure why they did not see a significant increase in the incidence of leukemia in the early part of the study after the accident. That could be for several reasons. Your book goes into it, but very difficult to detect for sure those reasons. That's on page 171. They have found now that there were a 50% increase in leukemia cases in both children and adults, and an increase in breast cancer. This is just a slide about the studies that are currently being done to study lifespan shortening from radiation. Okay, so talking about cataracts now, we're going back to tissue effects. So there's a high probability that a single dose of approximately 2 grays in the tissue, the lens of the eye in specifically, will induce formation of cataracts. Cataracts are partial or complete loss of vision. They have proven that radiation induces cataracts by lab experiments with mice, and that it follows a threshold nonlinear dose relationship. Okay, this is just a picture of the eye. Cataracts form in the lens of the eye. This is a good lens that's clear, that deflects the light properly. And this is a lens that has a cataract, which is like a cloudy, damaged lens, so that the vision's obscured. Okay, birth defects. These are the stages of gestation in humans: the pre-implantation, 0 to 9 days, organogenesis, and fetal. You need to know those stages. Okay, radiosensitivity during the first trimester. It is crucial. Large number of stem cells during this period of gestation. Okay, it is the most sensitive at this point. Okay, which is about 2 weeks or so after fertilization, so 10 days around. Prenatal death is the most obvious adverse consequence of any kind of exposure at this point. If this doesn't occur, the pregnancy can just simply continue. Irradiation of the fetus during the first 12 weeks of development may result in death or severe congenital abnormalities. Okay, any kind of exposure during organogenesis, which is that 10 days to 12 weeks, first trimester, abnormalities that can occur during this period are growth inhibition, intellectual disability, microcephaly, genital deformities, sensory organ damage. So just remember that you are the most radiosensitive at this stage in the pregnancy. Okay, embryonic effects resulting from Chernobyl. They are being reviewed. Fetal effects such as mortality, malformations, intellectual disability, and childhood cancer were reviewed by the United Nations Scientific Committee on the Effects of Atomic Radiation. It is also from the international Chernobyl project. Okay, biological effects of ionizing radiation on future generations are termed genetic or hereditary effects. They can occur as a result of radiation-induced damage to the DNA. Now, some damage to DNA does occur spontaneously, and that's called spontaneous mutations, okay? And in fact, in humans, a hereditary disorder is present in approximately 10% of all live births in the United States, okay? So certain agents can increase frequency, though, of mutations, and one of them is ionizing radiation. Two others, viruses and specific chemicals, which are called mutagens. Okay, so ionizing radiation is one of the most effective mutagens known. Okay, the incapacities of mutant genes. Okay, mutant genes cannot properly govern the cell's normal chemical reactions, and they can't control the sequence of amino acids in the formation of proteins. So you're going to have adverse consequences. Now, point mutations can be either dominant or recessive. Radiation is thought to cause primarily recessive mutations. Now, for a recessive mutation to appear, both parents must have the same genetic defect. So this means that the defect must be located on the same part of the DNA-based sequence. Because this rarely occurs, the effects of recessive mutations are not likely to appear in a population. Okay, the only concrete evidence showing that ionizing radiation can cause genetic effects comes from experiments with fruit flies. Information obtained from these experiments suggests that hereditary effects do not have a threshold dose, okay? And because this means that even the smallest radiation dose could cause some hereditary damage, there is no such thing as a 100% safe gonadal radiation dose, okay? So, and that is it for chapter 9, you guys. This was a heavy chapter. Study hard. I will put a study guide up after homework is due tomorrow night, so it'll be available on Saturday morning for you. And then I will see you next week. Tuesday is your test. Have a good evening.